Hello, this is Dr. Lewerenz at Longevity Health Institute in Rochester, Michigan. Hope this finds you well, and I'm going to bring you a little info tidbit that came to me today in this office, kind of enlightened me a bit, and I thought, hey, this I should share with my patients, my followers, and viewers, where you could share with others. Most of these patients and these experiences I had today were visits from patients that were either new or newly established, and I was going over some data, some results, and reviewing some things with them. So typically an experience here in our office with a new patient in our functional medical approach is a 45-minute to an hour all-encompassing visit where we deal with goals of what they're here for. We go over a functional medical approach, a very personalized medical approach, and we look at root causes of things, but we also then do the testing and go through some things that are also our goals, which is to make you well and to live healthy in a preventative optimal lifestyle. So today we had the pleasure of seeing a few of these back, and I wanted to share some of these with you. So one was a gentleman that actually was in his mid 40s or low 40s and had some fatigue and had some what he thought was some hormonal issues and hormonal delays or imbalances, excuse me. And he was correct, he did, but one of his goals was he wanted to be ripped. He wanted to get lean, he wanted to get fit, he wanted to get in shape, and but I mean really lean, and he already exercised and did a lot of things, and I said, well, look, let's try to achieve some of these, but let's try it more from a functional purpose, a natural purpose, a route where we do some things that are going to naturally optimize your testosterone in diet, in supplements, and an exercise program. And he came back with hormone levels that were not that deficient, but his estrogens were a little bit elevated. So in this particular person, actually at his age, one of the main things we did is optimize his diet and his exercise and dietary program, but we used a few supplements and things that help your liver metabolize estrogen. And when you get rid of excessive estrogens in your body, through liver detoxification, and so through some things that are from cruciferous vegetables like broccoli, cauliflower, and extracts in those that are called diindomethane and indo-3-carbinol, those help your liver and help your body detoxify estrogens. And anytime you take a male and you still have optimal testosterone or a good amount of testosterone, and you limit or eliminate excessive estrogens, you're going to get leaner. So my hopes with him, because he's very motivated, he goes to the gym and works out and exercises and does a lot of the right things, we'll be able to optimize his testosterone to estrogen ratio, and he will get leaner. So that was one case, and I think a very good hope and a good insight that I think he will do very well. We had another patient that came in and was new, and her big issues were weight, some anxiety and elevated heart rate. She was 45. And I'm looking, actually, I can't show you much, but I'm looking at my charts here. And the thing is that overall her energy was pretty good, but she had something that was very interesting that I wanted to share with you that we see in some of these systems approach that we see off. And if it's not corrected or it's overlooked, it can be just band-aided and then create more and more problems later as you go and get older and evolve in life. One of her issues was this anxiety and elevated heart rate, even to the point that she actually has an electrophysiology cardiologist. She's on a medication that's called Coreg, which is a beta blocker to keep her heart rate down. And this is a female that actually works out, eats well, is pretty fit, has two lovely twin daughters, 6 years old, is very active and actually feels good but wants to lose weight, but she has this very odd thing where her heart rate, even with this medication, is in the 70s and 80s at rest, and sometimes even 90s and 100. And if without the beta blocker, without the medication, she gets these big spikes in her blood, excuse me, in her pulse. And she feels well, and her cardiologist has this managed, but our question would functionally be why. And here's some of my thoughts and some of the things that we kind of looked at and digged into, and I'm very suspicious of, and have a good idea what's going on because we did some blood analysis here. When you have low magnesium, you'll tend to have a higher elevated heart rate. She's an athlete. She goes through a lot of water-soluble magnesium with exercise and sweating. It's a very common deficiency with aging, with malabsorption with aging, and we need a lot of magnesium to actually support muscle and tendon in that. But when magnesium's low, arrhythmias and heart rates tend to go higher. The other thing is that fatty acids. When you have a lack of absorption of fatty acids or good fats in your diet, okay, or absorption of those fats, you will have a little bit of excitable and elevated, potentially, heart rate and arrhythmia risk, okay? So these are some of the things that we're detailed looking into, but I already recommended to her to maybe try some of these and elevate some of these to start regulating her heart and getting some better result there. The other thing is, though, that she is going into menopause. She's perimenopausal, and often what we see here is if somebody gets hormonally imbalanced in their adrenal hormones and or progesterone, their heart rates can be elevated. Now this may only account for 30 or 40% of what's going on with her, but I'm very, very, very hopeful that this is going to really help us and help her where the old saying, the rubber hits the road, and actually get her a result so that she can potentially get off that beta blocker medicine, exercise without any risk of arrhythmia, and then she'll have a better overall well-being feeling of she can push her heart rates for exercise and that as we work on her with a hormonal kind of balancing dietary program, exercise program, and to make her well. And she was lovely. She'll do fine. She's very, very healthy, but it's a very odd thing because she's had a huge cardiovascular workup with no real answer why she has this elevated heart rate. I believe it's adrenal, nutrients, magnesium, fatty acids, and potentially the sex hormone, progesterone also. Another patient that I thought was very, very interesting, and this is just more of a good story. She actually is a 52-year-old, very lovely worker for the auto companies, and actually today was her 4th visit. And in 4 visits, in approximately 5 months, she has completely resolved with our therapies and with balancing her basically in this functional medical model. Hormones, no hot flashes that she had. Her energy is 80-90% better. She's very satisfied with where her energy level's at. She's sleeping, quote unquote, much, much, much better, okay? And she has Morton's neuroma, which is basically a nerve irritation or a neuropathy from some tissue, basically structural things in her foot, and she had developed a lot of numbness and pain in her feet. And we found that her B12 level was real low. We elevated her B vitamins as well as B12. We de-inflamed her with the right type of diet and got her gut health better. And she has no inflammation. Morton's neuroma doesn't bother her. And again, back to good energy in that. So literally in 4 visits, this patient has done very, very well from all her complaints, and then where I can positively look at her blood and impact her life to make her well and be in a preventive model. Because we de-inflamed her, we optimized her hormones naturally, and we optimized her diet and gut health, and it made sure that she was detoxifying well. So a great, great, great example of somebody that wasn't that complicated, so it was fairly quick, but about 4 months, 5 months, she resolved a lot of these issues. So hopefully this is just a little bit of enlightening into an experience that we would, you would have in our office with myself or my lovely nurse practitioners who are well educated and guided by my protocols. But here at Longevity Health Institute, we aim to not just solve your goals, make you well, but with a little bit of work on your part and our part, we can create a beautiful preventative model that's going to serve you well for years to come. So I hope you have a good evening. Hope this was a little enlightening, and I hope you're well. This is Dr. Lewerenz at Longevity Health Institute. Be well.